Hello, everyone. Welcome to our webinar today. My name is Lacey Ahern. I'm the Program Director for Global Partners in Care. We are a US-based organization. We work with palliative care partners around the globe. Many of you on this call we've worked with before. Our mission is to enhance access to palliative care. And we know that communications is a very important part of that. So today, we're happy, together with the African Palliative Care Association, to bring you some expertise in boosting your communications. Our goal is to help you improve your online impact. So I'm not going to talk for long. I just have a few housekeeping measures. You will notice this is a meeting format. This is not a webinar. We did that intentionally so that this could be interactive and we could easily take questions and have discussion with you. So we would ask that you please make sure you are muted and that your video is on or off, but that it's not distracting while the speakers are presenting. And then we'll come together for some Q&A, and then we will actually put you into your breakout rooms that you signed up for so you can have a deeper discussion in a smaller group. Our goal is to make this interactive, helpful for you, and we want you to walk away today with some tools and ideas that you can use immediately. So I'm very briefly going to introduce our main speakers today. Hannah Nichols runs communications and events for the Hospice Foundation. Hannah has over a decade of experience working in communications. She also works with Global Partners in Care Communications, as we are an affiliate organization of the Hospice Foundation. And she was with us in our previous webinar and is going to recap some of that and take us a bit deeper into building your online presence. We are also joined today by Lee Meinert, who is the Advocacy Manager for the Hospice and Palliative Care Association of South Africa. She has spent her career working as a social entrepreneur, and prior to joining HPCA, she co-founded and led a free-to-student business called TSIBA. We're also joined by Nicole Capper, who is the owner of PR and communications agency Mango OMC, and she is a communications consultant to HPCA. She also serves as the regional head for Africa of the International Public Relations Network and on the IAB South Africa Digital Influencer Marketing Committee. So we have some really great expertise on the call today. Lastly, we are joined by Cindy Sierfoss, our Global Partners in Care Partnership Director, who also has extensive communications experience, and she will pop in for some discussion as well. And then lastly, Wedzerai Chiyoka is the communications consultant for the Africa Palliative Care Association. She also comes with extensive expertise in communications. And I'm going to turn it over to Wedzerai now to set the stage for us and begin the webinar. Thank you.
Thank you, Lacey, and good afternoon, everyone, from the beautiful city of Kampala in Uganda. I'm just going to do a quick recap of the previous events that we've had that relate to where we are today, just to give a background of why we are holding this webinar today. So we started a series of these webinars in December 2020, mainly because there were some requests for capacity building in terms of online presence. Obviously, people are aware that being online has become more and more of a necessity rather than a luxury, and people need to be online in order to have a greater impact. Because all the different online platforms are emerging as important media for communication globally. And a lot of our hospice and palliative care organizations were either not online or they were just online because, you must have a Facebook page and so on, but not really having much impact from being online or not having whether it was the skills or the time. So we started this series coming from inquiries and such queries. There's also an acknowledgement that a good number of NPO funds go mainly to your programs and services, and time to attend to communications issues is often a challenge. We often don't have full-time communications person. A few of us are fortunate to have them, but some of us do not have, and yet even with the COVID-19 pandemic, it has exacerbated the need to be online, to continue to be visible, even if you are not physically present in a place, to continue to communicate your message, even if you are not able to meet with the target audience that you need to communicate with. So this is part of what prompted this whole initiative. Being online has many advantages. I might speak the obvious, but it's really just to bring everyone where we've come from. We are looking to reach out to like-minded people like us, as well as recruiting new people that may not be interested in what we are doing, but we want to convert them to become, to join our cause, to engage new entrants that can become interested in whether it's hospice services, palliative care services. Some can become donors, some can become advocates, some can become voices out there, or support in one way or the other, and others could just become aware of the availability of such services so that they can be users of the services. So any post you have online can bring a reaction that can go. You never know where it will go. It can end up attracting a site visit. Someone might become interested to come and visit. Some can eventually develop a partnership. So there's a good number of stories that are told of how people made connections online and built meaningful relationships out of that. The beauty of a lot of the online platforms is that they have these discovering features where algorithms can help you to connect with people that are interested in your subject, or they prompt, they bring you pop-ups that relate to your subject or to your area of work and areas of interest, which also helps you, instead of just doing a broad search, you can get prompts that lead you to subjects of interest. So just a little bit of focus on Africa. A lot of a huge percentage of the African population is online. We have stats that show up to maybe about 500 million people using the internet. And of those 500 million, a bit over that, and of those, about half of those as well are on Facebook alone. And if you could maybe just reach even just 10% of that, you've already got something like 25 million people seeing your message. We may not reach 10%, we may just reach maybe 1% or 0.1%, but it's still a significant number of people that you can reach. And acknowledging that the minimum, it's at a minimal cost, usually just the investment of time that you need to allocate for the person that handles that. So there's huge potential to still have our voices out there and to reach a broader audience beyond our communities, beyond our operational areas, and to mobilize support, to mobilize to get uptake of our services for people that are in need who may not be aware of the existence of those services. So Facebook is the most popular in Africa, followed by Twitter and YouTube. And then we have people on LinkedIn, Pinterest, Instagram, in that order. Obviously, your targeting will depend on what it is that you want to achieve and what action, if any, you want them to take after they have seen your message. Statistica.com shows us also that about 40% of people find nonprofits who donate on Facebook. About 40% of people discover nonprofits that they donate to on Facebook, just on Facebook alone, without looking at all the other social media platforms. So that's quite big, 40% of people deciding to support something that they have seen on Facebook. So there is value in that. We just need to be strategic about how we do it. Part of what has been done in previous webinars was to help us to define our target audiences, and how to maybe develop appropriate messages and so on. And it's part of what we'll be covering also today with the expertise that's in the room. I think that's as far as I can go. It's really just to capture the why we have decided to do this and why there was the need to start doing these webinars. So let me hand it back over to you, Lacey. Thank you.
Thank you very much, Wedzerai. I just put this in the chat box, but we will share the recording and slides after the call. So please take notes, but know that we will be sharing that as well. Additionally, please also feel free to enter questions in the chat while the presenters are talking, and we will be receiving those and we'll get those answered for you. So without further ado, Hannah, I'm going to turn it over to you. Thank you.
Great. Thank you, Lacey. Good morning, everyone. Let me just share my screen here. Okay, so as the others mentioned, we did have a previous webinar. So if you have not had a chance to watch that, that will be posted in the comments either during the presentation or directly after. And we can share the link as well when we share the slides at the end. So you can go further in depth with some of the things I'm going to recap this morning. First, I'm going to talk about, like I said, the recap of what we began last webinar. And that includes kind of the basics of getting started if you have a social media but haven't done much with it, or you know, don't have one and want to get online and aren't sure where to start. That's what we covered really last webinar. So I'm just going to quickly recap that, go over some of the main points, and then talk kind of the higher 30,000 foot view of the, you know, how to engage followers and then how to sustain them. So through creating a full year strategy and then how to create a content plan. And I know that Nicole will go into this more depth for the South African context. So you can get a couple different views of how to get started and then where to go and how to build that audience. So I am Hannah Nichols, as they mentioned, and I work with Hospice Foundation. We are a GPIC partner, and we're partnered with the Palliative Care Association of Uganda. So again, to recap, just some best practices for getting started if you're not online or if you're not on social media. So you want to focus on the, one or two to get started of the social media platforms that are popular in your country. So for us, the two most popular that we focus on and that we're going to focus on in this webinar are Facebook and Twitter. So this may be different for your country. So we can give you some stats and things like that, maybe in a one-on-one session afterward. If you're not sure where to get started, we can help you with that as well. But you want to pick kind of one or two to really get going and get the momentum going while you get used to posting. Next, you want to create a business account. This is so important because if you use a personal account, it just doesn't quite legitimize your page like a business account does. So you want to make sure that you're using, as much as the platforms that are the tools that they provide for you in the best way. And doing that is creating a business account for your organization. It makes you look so much more legitimate and will make people be able to interact with you that much easier. Always set your organization's logo as your profile photo, and then you want to begin to build your audience. And you do this starting with using the platform tools, such as scheduling and analytics. And these are built into the platforms themselves. They're very user-friendly and they're just built to make it easy for you. So definitely use them. You can see at the bottom there, I have what it looks like to go in and actually schedule posts. So you don't have to go in at 8 a.m. or 9 p.m. or whenever you're scheduling. You can actually just choose an hour a day or hour a week and get started with that scheduling. So next, it's important to understand what an algorithm is and what they do. So basically, these are built into the platform. They run kind of behind the scenes, and they determine which posts people see and what order they see them in. And these are important because they will determine whether your organization gets seen throughout your posting experience. And the main purpose of them is to get the users that are on the platforms to actually see more ads. So whether we like it or not, right, the platforms want to increase their engagement. They want to increase the ads that are seen. So we need to play into that if we're going to have our pages be seen by our followers. And so basically each platform will reward your page if you give people a good experience. So if you're posting engaging content, if you're getting people to have conversations, your page will be rewarded. Your followers will see more of your posts, and then they will see more ads, so everybody wins. And then we want to look at what algorithms look for, or what they look like, and then how we can really increase that impact. So there's hundreds of things that an algorithm looks for. We can't play to all of them, but there are 4 main pieces that they look for each time with each post. So it's relationship, content type, popularity, and recency. So relationship, do your followers engage with your page on a regular basis? What type of media are you using? Is it a photo? Is it a video? Is it a text? And are people engaging with that? What about the popularity? Are people reacting to the post? Are they liking it? Are they loving it? Are they crying about it? You know, are they engaging with the post? And then recency, how old is the post? So we want to post when our followers are online. And this is important because that will make it that much higher in their newsfeed. And you can find all of this information out on your analytics or your insights page, which we'll talk a little bit about. So how do we work with an algorithm on a limited budget? Obviously, if we can have a great big marketing budget, that would be wonderful, but not all of us do. So working with an algorithm on a limited budget is actually quite easy, but it does take a little bit of work. So first, you want to reply to your messages as soon as possible. And that goes for comments, messages, questions on your page. As soon as you can get a reply to those, even if it's just a, hey, we're looking into that, we'll be back with you, that's fine. The platforms want to see that you are responding quickly. And then you want to post engaging content that people want to discuss. So this isn't necessarily an interaction with you and your followers. That's very important. But you want to encourage your followers to have conversations with each other. And the algorithms love this and will boost your posts naturally. And then use emotion. Don't just go for likes. Likes aren't quite enough anymore. You want to have them love it or care about it or engage with it in some way. And those are those icons at the bottom of each post where you can kind of hover over and have your followers select an emotion. That's what the platforms love to see. So if you can get them to engage emotionally, that's always better than just a straight like. Again, post when your audience is online, really utilize those analytics and insights tools, and this will help you to figure out when your audience is on and when is the best time to post. Next, videos are your friend. If you can do a video, even if it's just with your smartphone, the platforms love videos. Our followers love videos. We love to watch videos. You will get so much more engagement if you can post a video or a really great photo. And then last but not least, invite the people that are interacting with your posts to actually like your page. So you can do this again, hovering over those icons at the bottom of the page. It'll show you how many people like or love or are sad about your post. And then you want to hover over those and you can actually invite them to like your page. And then this brings them into your kind of family of followers and will continue that engagement further on down the line. And next, you want to determine your demographic. And this is important because you want to sit down with your team and determine who you want to follow your page. So this is what we call a desired demographic or your ideal demographic. Who do you actually want to engage with? And then look at your analytics, and you can see a snapshot of that here. Who is actually following your page? Are they the same thing? Sometimes they go right hand in hand, and sometimes they don't. So if they don't, then you want to post toward that desired or that ideal demographic that you've identified beforehand. Create posts that will encourage them to follow your page as opposed to maybe who actually is. And if they're the same, then great, you're already a step in the right direction. So as you can see here, you can see a lot of different things about the people that are following your page. You can see, are they men? Are they women? What country do they live in? What city? What language do they speak? Going across the top of this image here, you can see different types of things. And as you go through those tabs, it will give you different demographic information about each of them. So you can really learn a lot about your fans and your followers, and then you can market towards them or post towards them, and what they actually want to see. So next, if you can, set a quarterly or a monthly budget. So this is important because, again, the platforms want to make money. They want to boost your posts. And so even just a small amount goes a long way. And I know that Nicole, I think, is going to talk about this a little bit more specifically in your context. And this will depend, it will really vary per organization, per country. And so you have to find what's right for you, but just keep in mind that a little will go a long way, and it is important to get started if possible. Next is when you've set that budget, you want to create an engaging ad. Videos are best if you can. Again, you don't need professional equipment to do this. If you have that, that's great. But if not, you can use a smartphone, write a script ahead of time, and you can create a very professional looking video ahead of time that is engaging, that gets your message and your mission across on a very low budget. If not, you can create a slideshow with Facebook's ad building tools. And I say Facebook, but again, this goes for Twitter, Instagram, Pinterest, wherever you're working. They have some great ad building tools and will help you do that. And they're pretty user friendly as well. And then again, use engaging emotional photos and content. You want to really show what your mission is, make sure that it's professional, and always be aware of our patient privacy and then also our staff privacy. Make sure that you have permission to post and that you're using ethical photos and ethical videos when you do that, but really get those emotions going, and that will help with your advertising. And then again, back to the demographic. This is so important. If you can sit down and determine that ahead of time, it will help you when you go to actually advertise. So you want to choose logical connections to the audience that you want to attract. Again, this is not necessarily who is existing and following your page currently. That might be the case, but if it's not, then you want to make sure that you're posting towards the audience that you want to attract. So this is a snapshot below here on the screen of some different interests that you can choose. You know, what education level do they have? What finance level do they have? Are they married? Are they single? Are they parents? Are they, what do they do for work? Are they in the medical field, or are they, in working in an office? You can determine all of these things and really target who you want to advertise to. And then you can see as you go across the tabs there, you could go into different interests, different behaviors, and then more categories from there. And this is important. Take the time. It doesn't take very long, but go into this and really look at what all the options are, and you can choose some very specific demographics and really target the people that you're interested in having follow you. So how do we sustain them, right? If we're engaging them, we got the advertising going up, how do we sustain them from there? And there's just some simple best practices that you can follow as you're doing this and as you're building your audiences. So first is don't spam, don't post too often. And again, this is going to vary by country and by region, depending on where you are. So for the US, we post about once a day on Facebook, a couple of times a day on Twitter, and that's pretty sufficient. In your country, it may be a little bit different, but you want to kind of figure out what the standard is. And again, we can help you do that in a one-on-one. I know that Nicole's going to talk about it a little bit as well for the South African context. And so figure out what that is, what that sweet spot is for your followers. And you can play around with this as well. There's no set rhythm that you have to follow, but you just have to find out what works for your followers. But just don't overpost. That's the key, which should make all of us feel good, because that means it's less content that we have to create. And then also offer content that is relevant to your followers, not just what you want them to know, but what do they want to know? What do they need as far as resources? And then be that resource. Don't just promote your organization, promote partner organizations, promote maybe community events if that's applicable, different research articles depending on what your organization is, and really give them more meat, more content than just selling your organization. And then you want to promote your partner organizations. And this is so important because you can tag each other, you can tag the other organizations. And again, I go in how to do that in the last webinar. But tagging them is so important because then you get mutual marketing. You get to kind of post to their followers, and then they can come back and post to yours. And it creates some great interaction on your page. And then last but not least, show the real people and faces of your organization. So you can see one here on the right. We did a series of employee spotlights at the Hospice Foundation, and people loved this. This got great interaction. I had a series of questions that we asked each staff member, and kind of prepared those ahead of time. Used our staff photos. If you don't have those, just take a great photo of your staff member, and just let your followers learn a little bit about each staff member, and it really creates that connection to your organization that's so important. And then we want to move into a content plan. So how do we do this on a regular basis? So first, you want to take time to organize your tools, your goals, and your objectives. So sit down with your team, whoever's going to be involved in that marketing or the communication pieces of it, but also get some people in the room that maybe know your followers really well, know your, whether it's your clients or your patients, whoever that may be, whoever's going to be following your page, get one or two of them in the room too, so they can offer that insight. And then collaborate. What do they want to learn? Who are they? What do they look like? What do they, what are their demographics? What are their home lives like? And that's important to kind of identify behind the scenes, and then you can market towards them that much better. And then again, look at those analytics and those insights. It will tell you so much about the people that are following your page, and it will really give you some ways to help you advertise to them. And then again, ask those community members, those donors, those patients. You can do this through different surveys. You can do this as patients at a clinic, maybe ask them what they want to learn, not necessarily on your social media, but ask them what they're interested in learning or what would be beneficial for them to know more about. And then you can post and market towards that. So this is an example of a year-long social media strategy. So this can look different for every organization. This is just what we happen to use. And if we go down the list here, you want to start with those assumptions. Who's posting? How much time do you have? And kind of fill in those pieces. So this is very broad, so it applies to everyone, but you want to get some specific information in each of these boxes that's specific to your organization. And then go down. What are your main goals? So these are broad goals, right? For your entire social media. What do you want to do with your social media? Is it interact with donors? As a foundation, it is for us. We want to tell our donors how their money is being used and what programs it's going to. We also want to promote events. If you go across the screen there to the right. And then we also want to educate. And that's so important because if we're not educating our audience, then we can't expect them to know what's going on with our organization. And then again, identify those target audiences and then identify the desired engagement for each of those audiences. So if it's a current donor, we want them to donate again. We want them to learn about the programs and learn where their money is going. We want them to come to events. If it's a prospective donor, then we want them to donate the first time, attend the events, learn about our programming, et cetera. So you can kind of see how we've divvied that out across the screen there. And then get your current distribution channels listed. Again, just good to know, good information to have for your whole team to see. And then potential, where do you want to be? Do you want to be on Instagram in 6 months or in a year? Great, list it. It's good to have that down on your document there. Then list the tools that you use, the tools that you could be using, your ideal velocity. So this is how often you want to post in the beginning, and kind of set that goal for yourselves. And then posting frequency and type at the bottom there. So, what do you want to post weekly, monthly, bi-monthly, and then kind of once in a while. And this, again, will just help you get started identifying what content you have and what you can easily create. So weekly, maybe it's a photo, it's a quote, a photo or a statistic, at least once a week. outside resource and inside resource for your organization, tag back to your website so they interact there. And then make sure that you're not asking people too often. And an ask is something that you want them to do. So if it's a donate, if it's a visit a clinic, if it's get more information, you want to post at least 3 resources every time you ask for something. So this is, again, just to help you get started. And then we want to talk about, okay, so what do we actually post? We have this year-long strategy, and then where do we go from there? How do we actually get started posting? So for us, it's a great way, or a great tactic for us has been to create a 2-week rotating schedule. And this kind of helps you keep on track, but it also is very flexible as you adjust your content and what you have to post. And it just helps you get started. And it really takes the guesswork out of what to post every day, and kind of creates a cycle for your followers to follow. And so you want to keep your organization on track, and you want to really post what's most important to your followers when you're doing this. So here's a quick example of what that might look like. As you can see, I have 2 weeks laid out. Every other Monday, we do a quote or a statistic. And then you can see the example post there. And then we also list who is posting. So I made these names up, but maybe Jane is responsible for the quote or the statistic on Mondays, and she gets that scheduled every, maybe she schedules out 6 of them in 1 week's time, because you can really schedule out for 6 months at a time. So this doesn't have to necessarily be a weekly schedule. But then on Tuesdays, you want to use stories that you already have. So if you have a monthly e-blast, this is a great way to repurpose that content. So you can see on the first Tuesday, I have the headline story. And on the second Tuesday, I have that second story in your e-blast. And again, you can't expect every follower that gets your monthly e-blast. You can't expect them to follow your social media all the time, or vice versa. You can't expect all of your followers on social media to have subscribed to your e-blast. So providing that content in 2 places helps your organization, because it's less content you have to provide, but it also helps your followers get that vital, important information in different places. And then you can kind of go down from there. And again, we'll share these slides so you have this, but it is just to get started. And if this doesn't work for your organization, then fill in what does. And then at the bottom there, this is important. I have kind of that supplemental posts. What can you fill in when maybe you've already used your secondary story in your e-blast? So there's lots of things that you can kind of fill in on those Tuesdays, still keeping into this 2-week rotating schedule. And it will take a lot of that guesswork out of what to post. So that is all I have. I know it was a lot of information, but again, we will share these slides. And again, check back to that original webinar. I go into depth about a lot of the things I just mentioned. And I know that Nicole's going to speak very specifically about some case studies that they have as well. So Lacey, I will hand it back to you.
Hi, Lacey. Would you like to explain the poll that's just popped up, or should I let everyone know what it's about?
Go right ahead, Nicole. Thank you.
Hi, everyone. I'm Nicole. I'm speaking from a not so sunny Cape Town in South Africa, and I see there's a lot of South Africans here as well as from around Africa. So really excited to be communicating with you all. There is a poll that should have popped up on your screen at the moment that says communication devices and is asking which device you're most likely to use when creating social media posts for your organization. If you wouldn't mind just ticking on whichever one you utilize and just ticking submit. That just gives us a little bit more info in terms of any other webinars of this nature, so that we're really understanding what the devices are that people are using across the African continent. So I'm just going to quickly tick on mine, computer submit, and then I'm going to pull up my presentation.
Great. And just for the audience to know, it looks like 74% use a computer and 26% use a smartphone.
Okay, that's great to know, because then I will include some information around smartphone usage. So I'll kick mine off. As per my introduction, thank you very much. I work with the Hospice Palliative Care Association as a communications consultant, and I'm extremely honored to be able to do so. And what I'm going to delve into here is a bit of the South African stats that we have available in terms of how people are utilizing social media in South Africa. And then I'm going to move into some case studies of what we've done with the HPCA. Obviously, these would not be models that you would follow specifically, but hopefully give some insight and some practical examples around how we've utilized some of the tools and tricks that Hannah's just worked through on actually putting content or campaigns together. And then in the breakaway rooms afterwards, we're able to go into more detailed info, and then obviously we'll answer your Q&As. So to kick off, I've got a few stats. You will be given these presentations, so I'm not going to spend a huge amount of time on them. This was in the third quarter of 2020 and was just showing what all internet users aged between 16 to 64 years of age were using. I don't think it's any great surprise to South Africans that WhatsApp is sitting at the top, and then Telegram, obviously, once it was announced that WhatsApp was owned by Facebook, Telegram became an alternative and more encrypted messaging system, but WhatsApp is the highest. YouTube is sitting second, which is primarily due to the enormous amount of video that people watch. It's not necessarily business related, it's highly entertainment related. Facebook is across both business and social, as is Instagram. Facebook Messenger comes up next, and I will touch on Messenger further on. Twitter, LinkedIn, Pinterest, TikTok, which is growing exponentially in South Africa and is very video fed. And then into our Snapchat and our Skype, which most of us do not use as a social media tool, but which are highly utilized, particularly during the pandemic, for meetings the same way as Zoom and our Microsoft tools are. The second load of stats are the most used social platforms over a year's period of time. So that's March 20 to March 21, and we see Facebook winning there. Pinterest is often used for home and decor. Twitter became a huge news feed. YouTube again was for both entertainment and for information. And Instagram has continued to hold its own as the most visual platform utilized. If we take a look at Facebook users in South Africa as of August 2020, which were the latest stats I could find, one of the interesting things for me here was that there's quite an even split between women and men. We often find on business pages that the majority of people responding are women, but this shows us that there are a large quantity of men that are actually utilizing Facebook. And if you take a look at the 25 to 34 age group, that's where they're primarily sitting. Messenger users are huge, 21,710,000. I almost felt like I was going to do a politician there of 21 billion, but there we go, 21 odd million. And onto LinkedIn, which in South Africa is a very, very powerful business networking tool, is not often used for fundraising, is not often used for huge community development, but can be extremely useful for things such as news clippings, media clippings, news about your organization. That still has a very high ranking at over 8 million users in South Africa, and the 25 to 34 group are increasing exponentially as more and more people have access to smartphones in South Africa. Instagram users has been huge for quite a while. It's at the 5 million mark. And once again, you can see that there are a surprising number of men that are utilizing it, primarily in your younger age groups, and then going down in your 35 to 44, but it's still, as a visual medium, well used. Many men seem to use it more for a social aspect than for a business aspect, but it is still highly utilized by the male demographic. Where I've come up with the primary platforms used in South Africa by NGOs is actually in my work across a number of NGOs, specifically over the last 14 months. And in all the channels that we have utilized across all of the NGOs that I've worked with, Facebook, Instagram, Twitter, and YouTube are the primary ones that are being utilized for everything from news, information, campaigns, announcements, and advertising. So the other channels such as LinkedIn or Pinterest, they can be used very carefully. LinkedIn is very good if you're in association, for example, but might not necessarily need to be utilized by you if you're an individual hospice. It might just take away from your time. And Pinterest really is used for home decor and fashion. So would only become valid if you were working within a realm such as sustainability. It's not necessarily one that works particularly well for hospice, for example. Hannah went into the engagement and how important that is. And one of the things that we need to emphasize over and over again is that the quality of your engagement is really important. Those likes and loves and emotive responses and dialogue and engagement are really important. So you might have 30,000 odd followers or fans, but you might only have 3% of those engaging. And that engagement percentage is the one that you need to really be following. So on the popular platforms, we all know this, but I've just included it as a summary slide. Facebook, visual or video or revolving GIF. Your revolving GIF can also be your slideshow, and we will show you some examples of those. Instagram works exactly the same, but with far less content. Twitter is really just your 280 characters. You can use pics if you wish to, but they're not generally they don't generally require pics. And then YouTube, you obviously have to have your good multimedia. You need good video. It's really visited on its own as a channel for something such as hospices. It is very well utilized for music, fashion, beauty, and entertainment. Algorithms, which Hannah did go into, mean that you can't just find new people or new community members to join your page unless you are using a combination of hashtags, content, and ad budgets. Ad budgets do not need to be huge, and I'm going to show you a couple of examples of these. So please don't be put off by the fact that you should put a little bit of money behind it, particularly if you are building a community. And by building, I mean, if you've got 100 followers or less, you're very much seen as building, and you will need to allocate a little bit of money to ensure that your post spreads outside of your page. Hashtags, we all know, and they're all those fun things, you know, hashtag living your best life and hashtag, etc. But hashtags actually are also a tool that are used by the social media platforms to enable us to follow conversations. So for example, with anyone that has been working with us on our Hospice Voices of Love, we have two hashtags. One is hashtag Hospice Week and one is hashtag HVOL. Those hashtags let me, as the community or the social media community manager, actually follow the conversations outside of my page. It also allows people to follow those conversations outside of their pages and is also used by the algorithms. So hashtags are actually quite important. And when you do decide on a hashtag, you can literally pop it into Google, see where else it's used, and be able to create your own hashtag from there and then include it on every post that you do. Content. Many brands use social media to advertise, and we do know that ads work across Facebook, but to build your actual channels is quite a different story. If you are building a channel, you need to be speaking to what people want to read, see, view, and Hannah has spoken quite a lot about that. What we found on the HPCA channels is that people really relate to people. We also find on the African continent that we are very much a story talking, narrative building, emotive nation. So across the continent, we need to remember that people are interested in your behind the scenes. They're interested in patient types of stories. They're interested in news that is happening within the palliative care sector. This could be a tribute to something that somebody has done that is extraordinary, but it could also be around a fundraising campaign, a new person joining, stats and data. So everything that you do, if you can contextualize it within what you would be interested in, that's genuinely for most hospices and for the HPCA, a very good benchmark to work on. If you would be interested in reading this, if you would be interested in responding to it, it's highly likely that this could be something that would be of interest to building your own channel and your own community of followers. As Hannah also mentioned, consistency is key. You need to decide how often you're going to post outside of campaigns and then stick to it. You can use country themes to make that simpler for yourself. So Hannah has that beautiful strategic plan that will be shared with you post this, but you can also Google what are the event calendars or the health calendars within each of your countries. In South Africa, for example, October is Cancer Awareness Month. Hospice Week is taking place in May. Family days happened both, they will be happening International Family Day at the end of May, and there was also a local family day that took place during April. So you can use those calendars to actually formulate content that then works within themes, which can sometimes simplify your brainstorming around what on earth are you going to post about. It doesn't always have to be directly related to your organization. It just needs to be contextualized within it. So for family days, we can highlight something around the holistic help that is provided via hospice and the holistic services and perspective and mindset. So you can find content scheduling and responding, very similar to what Hannah was saying. Within South Africa, there's another very good reason for content scheduling, and that is that our internet access is both expensive or it can be unstable. If we have load shedding, most people's internet goes down. You can run out of data. We often have the mobile networks that become overloaded. So a very easy way to ensure that your content is put up and that it does happen is to take a bit of time and schedule via the various tools that are available free of charge through the analytics pages and through the publishing pages of each of those platforms. I personally use my smartphone for notifications because I'm not sitting on a laptop all day and I can't actually access all of the comments. So I've set my smartphone up to have business access to all of the Facebook pages, Twitter and Instagram, so that I can see any comments on there and I'm able to respond on my smartphone. I wouldn't recommend necessarily scheduling on a smartphone. I'm quite pleased to see that most people are working on laptops, purely because that could take a period of time. And I will show you a content plan so that you can see how it can be best done. If you're able to sit and schedule on a laptop, I think it's just a little easier. It is possible on a smartphone, but potentially a lot easier on a laptop. So this is an example of a content plan. So this gets down to the nitty-gritty. Hannah's got the beautiful plan for the strategy. Then she's got the plan around what is the type of content that takes place each day. So this is a content plan that is actually showing you what the specific content would be. We do this a month in advance for all of the generic posts. And what I mean by generic is posts that can be posted up irrespective of any real-time events that are taking place. So on Thursday, the 1st of April, we posted up, what does palliative care do? We have a little note to say that it's scheduled on FB. It needs to be manually uploaded to Instagram. We have our link there, and then our image would be dropped in that is going to accompany that. All of these can then be quite easily scheduled, and real-time posts such as media clippings or something that comes up that's in the news that you would like to share then get interspersed in between this, which also helps you to ensure that you constantly have things happening on your social media without you having to wake up early in the morning and think, what should I post today? Frequency, Facebook and Instagram, we found that most people would accept about 2 posts a week. We do more when there are campaigns. We do know that there's going to be an iota of spamming for some of those campaigns, but generically we aim for about 2 posts a week, and Twitter we only use when there is news. One of the reasons that we only use Twitter for news is that I'm sure that anyone that is on Twitter is very aware of the opinions that are vastly utilized on Twitter. The troll-like comments, it can become quite political, it can get hijacked. So we really only use Twitter when there's news to avoid opening up any dialogues or getting involved in any commentary that we don't necessarily wish to be part of. Linking. Users don't like to leave a platform. If you consider what you're like when you're sitting on Facebook or Instagram, it's a bit of a pain that you need to actually link through and read something and then have to come back to Facebook. So we use links with the option usually of for more information, but include the content in the actual post. So you're able to decide if you would like more detailed information and then click through to them. We do try and ensure that there isn't a click through on every single post unless it is campaign driven. And even then, it's very structured. And when I go through some of the case studies, we'll show you how we think that through. One of the most important elements that I've found across every NGO that I've worked with is that the website needs to support everything that is on social media. What I mean by this is if you are going to be running campaigns or you are going to be putting in one donation post a month, then you need to have a click through from there that makes it exceptionally easy for people to donate. So a donation page on your website and donation links on your homepage make it far easier for people to then decide to donate than if you don't have that on the website and they have to scroll through and look for it from a homepage. We've also made sure that there are very easy to pay options. SnapScan in South Africa, for example, is exceptionally easy to apply for a code, register for a code, you receive it and you just upload it to the website. You can put it onto your social media, you can include it as a link, but you're not then relying on your social media post for people to make the donation, you're giving them a direct click through. If you're running a human interest story, whether that is a media clipping that has just been published in media, or it is a profile of somebody, include your thinking in terms of creating a website page for that. You can make dedicated pages for more information. And there are a couple of reasons why I also insist on the website being part of entire strategies. And one of those is that we're then able to see responses. So instead of just seeing your likes, you can actually measure click-throughs and you can actually see it on your Google Analytics. This gives you a lot of information about whether people are reacting to your posts or not. And it sounds as though it's quite complicated, but I can assure you it isn't, and we will get to the tools and measurements and those types of things in this presentation. Tagging, this was spoken about by Hannah in terms of acknowledging. We found that it is immensely powerful. So say, for example, We Can Change Our World runs one of our articles, which they did recently this week. We actually tag We Can Change Our World and tag them on Facebook. So we go and find their page, we like their page, we tag their page, and we then tagged everybody, all the hospices who had been quoted in the release as another acknowledgement of their contribution to our story. What happens with that is that because we've tagged We Can Change Our World, they then see that we have posted something and often share it onto their social media. They then also see that we've included a link through to their website, which means that when we next send them a media release, they are more likely to include our links in their media release, knowing that we always give back. So we found that the tagging is not purely to increase your followers in your community by having more people see it. It's also often used as a credit and to say thank you. HPCA has over 29,000 followers. So each time we tag somebody else, it shows up in their post and it gives all of our followers the opportunity to be able to click through and to see another Facebook page. So it actually becomes quite a win-win for all organizations involved. Ad budgets. This is where the less scary stuff happens. You can honestly go a long way with 150 to 200 Rand per selected post. If you decide that the absolute maximum that you can spend per month is 300 Rand on all of your Facebook and Instagram posts, that will go a long way as long as you choose your audience carefully, and Facebook Ads Center helps you do that. So it will give you the options to who would you like to target, and it will help you set that up, and it will show you how many people you will reach per day, how long you should be running it for, what the recommendation is, and then it will give you the full results at the end of the day. So your budgets do not need to be huge at all. 300 Rand for a month for a hospice is actually going to get you quite far. We don't advertise on Twitter and we don't advertise on YouTube. When you advertise on Facebook, if you have linked your Facebook and your Instagram business accounts, you are able to advertise across both of them using the same budget. Campaign planning. All of us do campaigns, and we're also going to be putting a campaign together with HPCA and with all of the hospices for World Palliative Care Day in October, which is going to be around fundraising. So I just very quickly wanted to include this slide about the way in which to think through what you're doing. So you have your generic posts that are going consistently during the week, and we slim those down but don't stop them when we're doing a campaign, because a campaign can also become a bit tiresome if it goes on for too long, and you don't want to just be hitting your audience with one message all the time. So when we're doing a campaign, we insert that into our normal generic planning, and the first thing that we think about is, what do we want our audience to do? I will go through the case studies and show you some of the thinking around the various goals that we set. We then think about the audience and we work out what would appeal to them. So that means content-wise. What type of content are they going to be interested in, and how should we put that together that will work for them? Do we then do a campaign teaser that says something is going to start in 3 to 4 days? Or do we decide that we just want to top and tail it with an introduction to the campaign, kick off with the campaign, and then end it? Our campaign, normally we do a maximum of 7 consecutive days. We are doing one at the moment that is far longer, but it's one of the few. But normally we do a maximum of 7 consecutive days. And then at the campaign end, just decide, what do you want that post to say? You may want to put that post together at the end of the campaign to say, thank you, we raised X number of rands, or thank you, we had X number of click-throughs to the profiles on our website. But that campaign end post is something that you strategically put into your content plan as a reminder to yourselves to communicate with your community to say thank you at the end of it all. Our measurement criteria would be, are we aiming for donations? And then if we are, how are we going to measure that? Where are we going to get that information from? Page visitors, engagement levels, those we can get from our analytics. And do we want website visitors? If we do, then make sure that you have your Google Analytics set up. And if you have a specific page, then make sure that you have a link to that page that you're going to be able to measure it at the end. The website content, once again, I come back to this, support your campaign. If it's happening on social media, but it would be relevant to your entire organization, which we hope that it would, can you put a banner up? So for Hospice Voices of Love, we've got a banner up on the homepage of the hpca.co.za website. You click through on that and it takes you through all the content that we're then pushing through from social media. Do you need to create a new page? We had to create new pages for that, but often we don't. Perhaps we've got courses that we want to be informing or educating people about. So we just make sure that our courses page is updated and that it has all the information it requires. And is the detailed information for the campaign on your website? Your social media posts are not going to allow you to post reams and reams of information. So you're breaking everything up for social media into bite-sized pieces of information, and you can rely on your website for the majority of the other information. And now we'll go into some of the case studies that we've done. So this is one. We've always had courses that are for healthcare workers, for caregivers, for palliative care professionals. These were also revised. And what we did was we created a whole new page on the HPCA website under resources that is for accredited and holistic palliative care courses. On the website, you then get all of the detail around each one of those courses, and we are in the process at the moment of actually developing forms that can be sent through for inquiries. We then supported this with a campaign that we ran on social media. We had our generic posts, and then we split up each one of the courses with each one of their key messages, but started with our introductory post, which was this one. So our key message was updated courses, and then the list of the 3 courses that they could actually go and visit HPCA, and then we had a direct link that went through to the courses page. This we then assisted by rolling out over a couple of weeks individual posts, and there on the right hand side at the top you can see our actual courses page. So that is the page that it clicked through to, and you can see that each one of them has their own section. It's summarized information, you can download PDFs, and we are in the process of now adding forms to that. So each one of these we had designed with a certain look and feel. They stand out from the rest of the content that we are posting because they look quite different. And as you can see, we went with a theme that was all in the HPCA colors, but all the posts around the courses had a similar look and feel. Each one of these, the visual was what we relied on for people to immediately gain their attention. And then we just put a little content up at the top. But the visual was the bit that we really utilized. And these are just a few more examples, and those became the occupational certificate, are you a caregiver? And then our last post, which was I'll spread the word. So that's what I mean by we start with one that summarizes what we're going to be speaking about. We then put up information that is succinct, that is easy for people to understand, and that gives them the option to look for more information. We made sure that the website was updated with all of that, and then we finished it off with, what do we want you to do? Spread the word. Our second example, this was on an online introductory session with the Sustainability Institute, which was around the Living with Loss series. This was going to be sponsored and is being sponsored for free. Lee is the genius behind all of this. And the first session was ready to introduce people to what the series itself would be about. In order to participate in that series, people had to actually apply. So to ensure that we made things as simple as possible, we decided to start off with the introductory sessions as an event. So there were 2 sessions. One was on the 27th, and there was another one that was prior to that. And we created 2 separate events for this, and we marketed them separately as events. So we put one up. When that one had completed, we then launched the next one. We then supported that with posts that had the full information, which is that middle one, the Living with Loss. And then we also boosted the event, which you can see on the top right-hand corner, that then just gave people an overview of it. We then supported that with individual and, as you can see, very visual-driven posts that also had the specific messaging that we felt would appeal to the different types of audiences. So I don't have the final numbers at the end of this. Lee would have that. But we do know that the introductory sessions were extremely popular. I'd love to know from Lee whether all of those 30 spaces were eventually filled out, but we do know that there was very high engagement with all of these posts. And as you can see, we didn't spam people. There was an event which went out to the entire page. We boosted that event post, which went to the entire page, but we then did not boost the individual posts, which would have meant everyone was getting the same messaging over and over again. We just put in 3 during the course of the process to ensure that everybody that that liked our page, was a friend of someone who liked our page, or was in our communities, did actually receive the information. This is an example of some of our donation posts. We tend not to spam people overly much with donations, and we try and include how to get involved type of messaging across our other campaigns. Primarily because I found that the South African audience has donor fatigue. I think everybody was trying to assist somebody during the pandemic. I don't know of one person in my personal or professional network that was not trying to assist with feeding schemes, that was donating clothing, that was running around attempting to assist people that they knew. So there's been a lot of donor fatigue. We also found that we didn't want to be asking people for money. We wanted to be educating people on what palliative care was, and alongside that, give them opportunities to become involved. So everything that happens on social media, we do support across our other channels with our website and with media relations. But as you can see, if we do put up something around donations, we do it by giving people very specific ways to contribute. So your donations change lives goes through to the donations page on the HPCA, where you can donate via an EFT, you can do it on credit card, you can do it via SnapScan, or you can add someone as a beneficiary on My School Card. And these we will intersperse within other posts so that the social media channels are not seen as consistently asking for help. It is every now and again, oh, and remember that if you'd like to get involved, please do so this way. The We Care movement, this was done last year. The We Care app is a free app that was launched to the South African market. It is available for Android phones, and it enables consumers to make direct contact with the hospice, and also contains information around COVID-19 and around what palliative care is about. You will note that in the majority of our campaigns, we speak quite a lot about what palliative care is about. When I started with the HPCA in early 2020, one of the biggest pieces of information I was given from media specifically were that they honestly thought palliative care was end of life, and that was it, and that hospice was a building and that it wasn't a philosophy. So a lot of what we do is educating around palliative care within the context of our campaigns. You may find that in your social media for individual hospices, that palliative care explanation and description goes a long way to educating people about the fact that hospice can step in with any type of life-threatening diagnosis. COVID-19, for example, is a life-threatening diagnosis for people with comorbidities. So what we did with this one was in early last year, we actually launched the We Care movement. We used the hashtag, as you can see, for We Care. It was all linked to the We Care app, and that was our I've just joined HPCA's We Care movement, which was the post that kicked it all off. That then linked back to the website, that is the banner that was up at the top, and then a combination of different posts, support for loss and grief. There were other ones about advanced care planning. There were other ones about how to find a hospice. And we then supported that with media releases that went out, and we uploaded those to the website and then used those as social media posts. So as you can see, this might look as if it's quite complicated, but it follows a very logical way in which you yourself would use the internet. So if you saw something on social media that was about an app that allowed you to actually contact a hospice, if you click on this and it takes you to the website that it tells you how to download the app and what the app is about, you can immediately see how that is going to be something that will result in you opening up your phone and downloading your app. If you then on the website, you've done that and you see that there's a media center right at the bottom and there's something that's about that, or you suddenly spot something in social media that's talking about the WeCare app that's linking back to an interview, you can see how you've now been enticed by providing content of different formats that's not taking an enormous amount of time to put up, but is providing more than one angle of interest. This also means that you're reaching more people because not everyone is going to react to the support for loss and grief, but they might be interested in ETV News speaking to Lee Maynard about the WeCare app. Ultimately, it's driving back to the same website with the same messaging, which is the WeCare app. It's just using different types of messaging for different types of audiences with content that you already have. So these are some of the others working together to spread the curve of COVID-19. The WeCare app brings hospices to you. We believe that everyone should have access to palliative care. So the key messaging was decided prior to the campaign going live to say, what are the various audience groups going to be more interested in? And then we developed the graphics for each one of those. Those graphics mean that you can choose to read the little content piece at the top, or you can click straight through. And that was what we ultimately wanted to happen. Hospice Voices of Love is one that many of the South African hospices that are here would be aware of. We sent out a call to hospices to please send us profiles, and we were absolutely amazed with the results. We received 69 profiles, which is why we are spamming people a bit, but we don't really care at the moment because they're just such beautiful hospice profiles, and they're of specific team members and of hospice groups. So we've called it the Hospice Voices of Love campaign. We have that top banner on our website that clicks through to the first page. That social media post went up as it started on the 26th, and that is an introduction to what we are doing. From there, you can see we have on the actual website, we've got our Welcome to Hospice Voices of Love page, which then lists each one of the hospices, the names of the profiles, and then an ability to read more. And then when you click on that read more button, it takes you through to the individual hospice, where we have included a bit of info about who they are, where they are, and their website address. And then you can read more. If you have, for example, for Breda River Hospice, that was one that was done as a group, you'll just see the one. But if there were a variety of profiles, each one of those profiles is there. We then link to that from our social media. So you can see we've taken the same image, we just dropped it into a template. We've used our hashtag HVOLove. And that then gives people the opportunity to click through and read the detail. That whole profile, that link there, goes directly through to that page. So this gives people the opportunity to decide whether they would like to go further or whether they wouldn't. But we have taken one little snippet out of each of the profiles to encapsulate who they are, which once again, it shows you we've used a visual so that it entices people. They can choose to read that. That will give them enough, which is going to allow them to understand who they are and what the philosophy is, or they can click through and read the full profile. We've also tagged each one of the hospices. This is so that each hospice gets notified when something goes up on Facebook, and also to say thank you to them as they then have the opportunity to share from our channel across to theirs. Some of the free tools that we use quite a bit, and free is extremely important within any sort of NGO type of scenario. Your Google Analytics are free. You just need to make sure that you have coding that is put into the back of your website and set up your Google Analytics account. It used to be incredibly difficult to use, but they have made it incredibly user-friendly to be able to understand what you're looking at, what the pages are, who your visitors are, when they are there, which pages they visited. Every single website should really ensure that they have a Google Analytics account set up. Facebook and Instagram, the analytics for the business pages, which Hannah also ran through, those are free of charge, and you won't believe how detailed those analytics are. You will adore them once you start using them. Twitter has exactly the same Twitter analytics for your business accounts. Design for most is very expensive, so we use Canva, which is free. It takes a while for you to figure out how to create your templates, but you'll find that you can create really professional looking graphics within Canva. And we use bit.ly links, which shortens links. So for example, on this one, you would see that there is a bit.ly link there for the whole profile. It not only shortens the links so that we don't have a very long link on there, it also allows us to measure how many click-throughs there are. That is also completely free. You just register, you set it up, and it's very user-friendly. This is just to show you what they look like. So that black screen up at the top is because I have black Facebook. You might have the white Facebook. That's an example of what your analytics look like. Your Instagram, you have separate analytics on there, and it actually shows you exactly how to set it up. And there we finish off. Sorry, I thought there was a Google Analytics one as well, which seems to have disappeared. But finished up here, and there are all of the links for the HPCA. So you are welcome to follow us and criticize us if we're not following any of the best practices that I've just gone through. And thank you so much for your patience, and I hope that wasn't an overwhelming amount of information. There we go. There we go, sorry. Twitter, there's your analytics, and there at the bottom are your Google Analytics, which shows you all your web data. You can choose how many months you wish to go back, how many days. It really gives you incredible information about your website. And if you're driving from social media to the website, it really lets you also match whether you're meeting your actual objectives. So thank you very much, everybody.
Thank you, Nicole. Thank you, Hannah, for these very, very informative presentations. There is a lot of information, as Nicole said. It can feel a little bit overwhelming. And so what we want to do now is to do some Q&A in the breakout rooms where we can start to talk individually with people about how they can apply this knowledge, this information about social media to their individual situations. We're going to keep those fairly short. And I do want to say to everybody, Global Partners in Care is available for consultation on some of this. If you reach a point where you want to talk a little bit more about how this information applies to you, please contact either Lacey or I, and we can set up a one-on-one Zoom meeting to walk through some of this with you further. So with that, let's hit the breakout rooms and start to chat a little bit about your particular situation and how this can apply to helping you gain followers, be more effective with social media, and get more engagement. Welcome back, everyone. As we wrap up and start our wrap up for today, I see a few more people are joining in the breakout rooms. What I want to do is thank everyone for your participation today, sharing your stories, sharing the great work that you do, sharing what palliative care can provide for patients is so important. And social media is a tool that makes that a lot easier than it ever has been. As Nicole had mentioned, sharing these stories, you don't know exactly, what this is going to, what the analytics will look like on the end until you go in and start to look at that. And that will help you craft your message even more effectively. The more you get in that loop of looking at what worked, who liked it, how did you get the feedback on your website? There is a lot of robust information out there, but don't let that stop you from making the first steps. The first steps are make sure that you have a good presence on social media, that you have access to those tools and are able to start understanding them. And the biggest thing, as I was just mentioning in the breakout room that I was in, is sharing your stories. Those stories that have a hero, whether it's one of your patients, whether it's your organization, whether it's palliative care as a whole, sharing those stories with a hero, the conflict, which is always going to be about symptom management or pain management or something that palliative care is helping solve. And then that resolution of the patient is now pain-free, their symptoms are being managed. The palliative care hero story is something you all can share, and it can all be shared in a lot of different ways and in a lot of different stories. We welcome you to tap into our Palliative Care Heroes campaign, and we will amplify your messages and share those out if you tag us in there, if you have us included in that, and we're always happy to do that. And I would just want to end with a quick note that Lacey and I are always available via email or Zoom call to help you work through some of your questions about social media, about stories. We will get technical experts like Hannah or Jim Wiscatoni involved if there's something that we can't answer right off the top of our heads. But we're here to help you share the great work that you're doing. We so appreciate everything that you do. We love to hear your successes, and we love to be part of all of that. So thank you all for being here today. As has been mentioned earlier, we're going to be sharing this recording. We'll be sharing all the slides, and we'll be doing more of these in the future. So let us know what you'd like to learn about. Let us know what you'd like to hear us work on in the future. Thank you all. Bye, everyone.
Thank you, everyone.
Bye.
Bye.
Thank you.
And thank you, AFCA, for making all of this possible. I should have said that earlier.
Bye.
I'm not even seeing Ruben. Ruben is not there. I think I'm the one.
Thank you, everyone. I will pull together the slides and we'll get those sent out.
Thanks, Lacey. Bye.
Bye-bye.
Bye, Wedzerai. Thanks so much.
Cheers. Bye.
Bye. Bye-bye.